Welcome to Optical Perspective, your go-to source for everything eye health, right here on Eye Health TV. From daily eye care tips to in-depth discussions on diseases that can affect your vision. Join leading eye care professionals as they share vital tips to keep your eyes healthy. Learn about the causes of blindness and how you can protect your sight. Discover prevention methods, explore treatment options, and stay ahead of potential eye problems. Whether you're looking to protect your vision or seeking answers to your eye health questions, we've got you covered. Stay informed, stay protected. Join us on Optical Perspective, your gateway to clearer vision. Only on Eye Health TV, right on YouTube, where seeing is believing.
Optical Perspective on Eye Health TV, where we bring you insights from experts on eye health. Today, we are diving into the world of cataracts, a leading cause of vision impairment globally. Join us as we hear from two esteemed ophthalmologists who will share their knowledge on this critical topic. And don't forget to subscribe to our channel for the latest updates.
In today's episode of Optical Perspective, we'll be discussing the topic, complicated cataracts, causes and management with our expert doctors. The questions we'll be exploring are: what distinguishes complicated cataract from standard cataract? What are the primary causes of complicated cataract? What difficulties are associated with diagnosing and treating complicated cataract? What advanced treatment options are available for managing complicated cataract? Can you share case studies demonstrating successful management of complicated cataract? How do you approach the treatment and management of these complex cases? Tune in as our doctors provide valuable insights and practical advice to these questions.
Hi, but Ulishola Utulani. I'm a consultant ophthalmologist. Complicated cataract. When you tell somebody that some cataracts are complicated, that means that person already understands what uncomplicated cataract is. So, but if you want to know about complicated cataract, there are so many cataracts that can be complicated. Cataract that has elevated intraocular pressure, that is not, that is recalcitrant to treatment. Of course, it's complicated cataract. Then, of course, cataract that also has maybe some problems with the drainage angle of aqueous, like those with rubeosis iridis or rubeotic glaucoma. It's a complicated cataract. Cataract that is not fitting well, maybe it is shaking, maybe because the zonular fibers are ruptured. It's a complicated cataract. There are so many complicated cataracts out there.
My name is Peter. My patients call me Dr. Adekoye. Can we actually call it normal cataract? In a way, it's normal because it's not the one we call age-related cataract. It's actually not a disease. So we can actually call it normal cataract because it is expected to come with age. Okay, so now if a patient at certain age develops cataract without any known factor or any factor identified for causing it at the expected age, those are the ones we often refer to as age-related cataract from the age of 50 and above and so on. Now there's another type of cataract that occur in diabetics. Patients that have diabetes mellitus, they have different types actually. They can have age-related cataract that may occur earlier than the expected age in them. Okay. There is also one they have that we call diabetic cataract, that is as a result of fluctuations in the sugar level in their blood system. Okay. So likewise, they can have complicated cataract. Age-related cataract has a course of growth and development and maturity. If we just leave them, we don't do anything. So the way we call them, or that the one that we can easily understand, is we can say early cataract. immature cataract. Immature means it has spread at least to a certain part of the eye, but at least patient can still see despite the cataract. But when you look, you will know there's cataract there. So that's immature. Then it gets to matured cataract. At the level of matured cataract, the vision of the patient comes down. That's the one that normally brings patient to us. The other way that cataract brings patient to us is when they say people started asking me there's something white in my eye. So even though they can still see, but it's becoming a cosmetic blemish that brings patients to. Now, after mature cataract, there's what we also call hypermature. That is, it is covering the whole vision. Now it has grown like, yes. Then there's a last stage that we call Morgagnian. That one has turned brownish. Okay, so that's the level cataract maturity goes. Now, between that hypermature and the other stages, sometimes that covering I referred to earlier, the outermost one, may breach by itself, and that releases some proteins that is inside the pocket into the front part of the eye. Those ones will now generate inflammations. It is the result of that that brings complicated cataracts, apart from trauma.
There are very many, so you can't say this is the main cause. Trauma is there. If somebody suffers trauma, blunt trauma to the eye, the lens in the eye, the crystalline lens can dislocate. It can either come forward or go to the back. Yes, it can drop in the vitreous or come to the anterior chamber. That's trauma. So there are some who are born with cataract that is not sitting in place. I'm not sure whether you've heard of patients with Marfan syndrome before. So the cataract is not in place. So there are so many causes of complicated cataract. But the one you are talking about, the cause will now depend on which one. There are some that have intermittent cataract, that is, the cataract is swollen. Because the cataract is swollen, it now pushes, there is a structure in the eye that gives the eye the color that we see. That's the iris. Pushes it forward, and then eventually blocks the angle of the anterior chamber, and then will not allow it to drain. That, of course, will cause elevated intraocular pressure due to the intermittent. So there are so many causes of complicated cataract. So trying to say this is the major one or this is the minor one, it depends on which one you're talking about.
Trauma is the commonest cause of complicated cataract. Then diabetes too, maybe for some reason or the other, they too can have complicated cataract. Then there are some other people that the sling that is holding the lens in place is very weak, such that the cataract will just displace itself from its normal position. Okay, so there are many things that can actually complicate cataract. So inflammation, infection, glaucoma. With the breach of the protein that I mentioned, it can provoke reaction that will make the pressure inside the eye to go higher. Just like football, when you pump it too much, it can even, yes. So, but eye sometimes rupture on its own as a result of excess pressure. But before it gets to that point, you will see redness, you will see pain. Patient will become very, very uncomfortable. So, and all because of this cataract that we are talking about. That's a complicated case.
There's no difficulty in diagnosing it. If you have the appropriate tool to diagnose cataract, it is true that we can use pen touch to examine the eye. But when you are examining the eye with the appropriate tool, the slit lamp examination or with any other form of magnification, because the eye is very small, so you need a form of magnification to be able to examine the eye. So if you have such, you should not have any difficulty in diagnosing complicated cataract. And then, of course, the treatment too can be technical. The treatment of complicated cataract can be very technical. Some surgeons may refer because there are some surgeons that we call anterior segment specialists. So they are the ones that are actually, they've going to specialize in treating cataract, any form of cataract whatsoever. So if it is not something that any ophthalmologist would want to do, it's not that he cannot do it, but would want to do in terms of managing the complications that is likely to arise from operating complicated cataract. You can refer to anterior segment specialist for appropriate management.
It's well, for us, it's not difficult to diagnose complicated cataract. Some may be painless actually. So for people who are not trained, they may not recognize that even that painless one is already complicated. But for us as a specialist, it's like saying, can you identify 1,000 naira notes? Almost everybody can do that. At least amongst specialists, it's a common thing for us to identify. But the other one that makes it easier are the symptoms, redness, pain, the one that will not allow patients to sleep. I used to tell my patients sometimes jokingly, just to educate them, that when you see large people in our clinic, they are divided into two sets. The first set of people, they brought their eyes. The second set of people, their eyes brought them. So what is the difference? Those that came and said, doctor, help me check my eyes. Is there any problem? Those are the ones that brought their eyes. But the ones that they have pain, the eye will not allow them to sleep. They cannot see again. Their eyes brought them.
I said, complicated cataract depends on what you are talking about. There are so many of them. It's possible for somebody to have complicated cataract from trauma. I told you, you can drop in the vitreous and come to the anterior chamber. Sometimes it is in place, but there's adhesion between it and then the iris in front. There are so many types of complicated cataract. So whether you now need a special thing to do it, will now depend on the one you are talking about. Of course, if it is the one that dropped in the vitreous, that means you have to get to the retina surgeons to be able to do that. So it's not something that I would want to do because I'm not a retina specialist and I don't have facility for vitrectomy. Okay, which of course, when it happens like that, you leave it for the retina specialist to do. But as far as Nigeria is concerned, I think we're trying our best. So we are third world, I agree. But if a patient can pay, there are facilities in Nigeria where such vitrectomy and so on can still be done.
From the simple options of administering drugs, yes. Next option, without doing surgery, we can administer YAG laser or laser treatment, different types of laser treatment to reduce the intraocular pressure, control the pain, and then the eye can be quiet as if everything is normal. Then at the tail end, we can go into surgery. The surgery, there are different types. We can just do a surgery to relieve the pressure with or without extracting the cataract. But if the pressure is high and there's cataract, we have to extract the cataract because removing the cataract is that you are removing the culprit that causes everything. So then beyond removing the cataract, relieving the pressure, there may be, depending on the degree of complication, there may be other things that are amenable to surgery that you still need to do within the eye. And sometimes we have the option of, after removing the cataract, should we put in an artificial lens or should we just leave the eye? Leaving the eye makes that eye like performing at less than 40% or 30% of its capacity. And then that makes it also to be very different from the fellow eye. So oftentimes we normally weigh that part of the option very well. If putting artificial lens will not cause the patient any additional trouble, we will put. And putting the artificial lens also, we have different options of site that we will put it. But the overall consideration there is we want to make that eye, if it's still seen, to be as close as possible to the fellow eye. Because if the gap in what this eye can see is different from what this eye can see, the brain that is linking them together will not be able to fuse the two inputs. So patient may not enjoy the vision. So those are areas that we look into, especially when we are doing cataract surgery, whether complicated or not.
Well, I don't manage, like I said, if somebody has cataract individuals, I won't touch that person. So I don't have any case to share. If I see such, I'll refer. So, but for the other ones, somebody who has adherence of the cataract to the iris or to the pupil, of course we manage that, and we have recorded some a lot of successes. And then if it is cataract, traumatic cataract with posterior capsular involvement, we have managed some, and we recorded a lot of successes with that. So if it is a subluxated cataract, which of course is also a complicated cataract, of course we manage some, okay, which of course we recorded some successes. I even have a video of one woman who also had I think subluxated cataract. So we did cataract surgery, and the woman was happy, and she saw after cataract surgery, because somebody sponsored the woman. So that was why we took a voice record, in fact a video recording of the woman to thank the person that sponsored. So we've done some, and then of course we've recorded a lot of successes with the little that we have done.
Oh wow! One, there are many, but I don't know. Sometimes patients comes with complication already. They feel, oh, the eye is useless, there's nothing they can do about it. We've seen cases like that after we examine, we'll be able to tell them this eye, we normally call it guarded prognosis. Guarded prognosis means after all our intervention, the outcome may not be completely very good for you, but at least we would have told you before we touch the eye. Okay? Now, there are some that we can assure them that from every test we have carried out, this eye will still see well after surgery. So sometimes patients won't even believe, with this trauma, with all the pain, with all this, with all that. Sometimes people use things they ought not to have used on the eye that even make the condition to get worse. So I don't know, I may not be able to cite a specific example. We live in a society that we see more of wrong cases, or cases that does not present early than those that present early. So most of the cases we do daily are the ones that we need to do one extra thing or the other to get results. Quite a number. So
it depends on the type. Of course, the treatment of cataract is the same. So it only depends on the type of complication the patient has. If it's a patient that has 360-degree posterior synechial, of course that means you have to do synechiolisis, which of course I'm sure this is too technical. It will be technical for my audience because you don't know what synechiolisis is. Do you know? So you have to first of all break the adhesion. Break the adhesion before you now start your cataract surgery. Okay. So, and if it is some that have, subluxated cataract. You have to be careful when you are doing your anterior capsulotomy. So there's so many of them. Cataract is cataract. The incision is the same, except the type you are doing. Whether you are doing a conventional extracapsular cataract extraction, small incision cataract surgery, phacoemulsification. Okay, so that's the difference. And the difference in all the three that I've mentioned is the size of the incision. The size of the incision. After phacoemulsification, the patient can leave the table, get up from the table and go back to work because the incision is very small. But for manual small incision cataract surgery, yes, the patient will have to rest a little. And then, of course, for the old form of extra cap, that's the conventional extracapsular cataract extraction. The patient will have to, sit somewhere because it's like an open room. You make a very big incision. So the patient will have to, sit at home for a while for the wound that needs to heal a little. So the approach is the same, except when you talk about the type of the complicated cataract, which of course they are very many. If you talk about subluxated cataract, especially in cases of the Marfan's, okay, you may need to do lensectomy. Depends on how dislocated or how subluxated it is. You need to do lensectomy, and you need iris claw lenses, which of course are done. All these things are done in Nigeria. So we are not really that third world that people used to call us. It's just that all these posh things are not available everywhere. We don't have here, but I'm sure if you want to use iris claw lenses, we'll be able to get. Because in fact, ophthalmologists have brought themselves together, including those who sell ophthalmic materials. So if we need, we just go to the platform, and then it will be delivered. So even though we are third world, at least we are still able to make do of the little that we have.
This episode of Optical Perspective has explored the critical topic of cataracts. We hope you found the insights shared by our experts valuable in understanding how to protect your vision and take proactive steps in your eye care journey. Remember, regular eye exams are key to maintaining healthy vision. Stay tuned to iHealth TV for more informative content. And don't forget to subscribe to our channel for the latest updates.
Without doctor's prescription, call on doctor's attention if you need solution. Too much is given, much is expected. Without doctor's prescription, call on doctor's attention.